Part 2 of my Vietnam series, Vietnam Veterans Fighting for Care. We revisited the Vietnam War, what our combat troops were exposed to, and how they were treated when they returned home. Tonight we take a look at how this generation, which now makes up more than half the VA claims in Nevada, is falling through the cracks through the story of Ken Anderson, whose exposure to Agent Orange during his tour of duty has caught up to this Marine. This is his story.
I hate it when that happens.
Simply adjusting his American flag is enough to take the wind out of Marine veteran Ken Anderson.
I'm on 24/7 oxygen, 5 liters stationary, 6 liters ambulatory.
Ken served with the Marine Air Support Unit in Vietnam from 1967 to 68. During his time in combat, he was exposed to the carnage of war, as well as Agent Orange herbicide used to thin the Vietnamese jungle.
We didn't know what Agent Orange was until we got back to the States and started hearing about it. I mean, they didn't tell us what they were doing with us.
After the war was over, Ken stayed in the Marines until 1972 and eventually moved to Tucson, where his medical needs were covered by the Southern Arizona VA healthcare system. In 2009, he moved to Sparks to be closer to his family as his health condition declined. Shortly after he came back to the Silver State, Ken was admitted to the Sierra Nevada VA hospital in Reno.
My primary care physician, who is a great guy, and I'm glad I have him, determined on his initial screening that I had Agent Orange symptom diseases, and he said, okay, we're going to track them for 6 months, see what happens.
After 6 months, Ken went back to see his doctor at the VA hospital and was diagnosed with non-Hodgkin's lymphoma and scannic heart disease.
The symptoms were getting very much worse, so he attempted to get me in to see hematology or oncology, and nothing happened. I was never called for an appointment, and this went on from 2009 until 2012.
With a heart rate of under 30 beats per minute, his doctor determined he needed a pacemaker, but the operation didn't happen at the Reno VA hospital. It was performed inside the emergency room at Renown Regional Medical Center before the VA could schedule the surgery.
When you're told flat out, you need some help or you're going to die, they did not mince words. I was told that by a number of people. And ultimately, when the Renown physicians wrote back to the VA is when somebody said, there may be something to this. Very frustrating, irritating.
And they were willing to do anything and everything that was asked of them. And we should do anything and everything for them.
Nevada Senator Dean Heller called for the resignation of Reno VA Regional Benefits Administration Director Ed Russell in June after an audit showed major mistakes were made in handling cases the VA deemed challenging or high risk. Heller says one of the major hurdles facing Vietnam veterans is a result of the way some handled their discharge.
You know, it is tough. I do know in my discussions with these veterans, they were just ready to get out. They didn't fill out the paperwork. They were out of war, they were gone, they wanted to get back to work, they wanted to get jobs, they wanted to start families. Last thing they wanted to do was look back. They wanted to all look forward. And because of that, in most cases, they didn't fill out the necessary and proper paperwork to get that done.
Retired Army pilot Mike Billow flew combat missions inside this Cobra helicopter during Vietnam. After the war, he chose to stay in and saw what happened to many of the veterans who left the service to try and get back into civilian life.
An awful lot of them said, I don't want anything to do with this anymore, I don't want to talk to anybody, I don't want to do anything about it, and they didn't go seek the help from the VA, although the VA help was there. At the same time, from the stories that I've heard, the VA was not a very good organization, and there were a lot of issues with the medical coverage that vets got.
According to the Reno VA Hospital, 65% of the patients they currently see are Vietnam-era veterans. I did speak with Darren Farr, who's a spokesman for the Sierra Nevada VA Hospital. He says he couldn't release much information on Ken's case because of patient confidentiality laws, but he did say since 2012 a lot has been done to improve patient wait times and overall performance at the VA, and a lot more is being done right now to improve that communication between healthcare providers at the VA and the veterans they serve. Now, meanwhile, calls to the Reno VA Regional Benefit Office for this story were never returned.
I mean, I came that close, Elias. They told me a number of times, if something isn't done for this guy, he's dead.
Ken says he knows in his heart other veterans waiting for care haven't been as lucky.
There's no doubt. There's no doubt. And I thank the man several times a day for being here.
If you are a veteran or maybe know a veteran who needs help getting through the red tape of the VA process, Senator Heller says his staff here in his Reno office are ready and standing by to guide veterans through the process of filing and tracking claims. Their phone number, 775-686-5770. Bottom line, don't do it alone. Find a veterans advocate to